The first panel is focusing on policy making and open science. I am honored to invite Ms. Heather Joseph, Executive Director of Scholarly Publishing and Academic Resources Coalition, who will act as the moderator of this panel. Ms. Joseph regularly participates in committees and collaborates on projects with US federal agencies ranging from the National Institute of Health Advisory Committee on PubMed Central to the National Institute of Standards and Technology Steering Committee to establish a research data framework. In 2019, she spearheaded the establishment of the National Academy of Science, Engineering and Medicine's Roundtable and aligning incentives to support open science, while internationally, Heather has worked on initiatives and consultations to promote the open sharing of research outputs at the United Nations, the World Bank, UNESCO, and the World Health Organization. Her community service includes terms on the board of directors of the nonprofit organizations that support the open sharing of knowledge, including PLOS, Public Resource, DuraSpace, the Center for Open Science, and Our Research, as well as extensive volunteer advisory support for new and developing open initiatives. I am also delighted to have worked with Heather in the 2019 conference, and I think the one element that I admire from Heather is her commitment and support for the early career leaders and the young researchers on their way to enter the open science community. Heather, the floor is yours.
Thank you to the UN and the organizers for putting on this most important and timely meeting. As Dr. Nair Bedwell so eloquently discussed in her keynote, open science really holds the promise to democratize our collective ability to contribute to and benefit from our shared global knowledge base, to accelerate discovery and to improve the public good. During the COVID-19 pandemic, open science practices really took center stage around the world. We saw researchers turn to open as an enabling strategy throughout the entire research lifecycle to help science rise up and meet the moment, openly sharing data, preprints, articles, materials, and methodologies in as close to real time as we've ever seen before. This really unprecedented use of open contributed to the fastest time in sequencing a genome to developing an effective vaccine in human history. Of course, with these upsides also came new challenges. It really highlighted the need for us to upgrade our physical, our technical, and our human infrastructure in the research enterprise to be able to more effectively and efficiently deal with the flood of new information happening in real time, and to really be able to ensure that we could support a research ecosystem where rigor, integrity, and trust in science remain bedrock principles. I think citizens and policymakers alike recognize the need to learn from this moment and to chart a path forward that allows us to codify the best of what we've learned. What we've learned works during the pandemic into a policy framework that will enable us to enhance our progress towards other urgent societal challenges, those represented in the UN Sustainable Development Goals, and in particular in climate change. The esteemed panelists that we have today will focus their discussion on identifying current opportunities and barriers for creating policies to enhance sharing of scientific knowledge to help us solve our greatest societal challenges. We're very fortunate to have 4 esteemed panelists to speak with us today. Each will open with a 10-minute intervention, highlighting key points and opportunities in their regions. At the end of those interventions, we will have ample time for question and answers. Much like in the keynote session, we ask the audience to please put your questions in the chat box and we will get them to the panelists. I'm going to introduce the panelists up front in the order in which they will be speaking. So one by one, my dear panelists, I will just call your name when it's your turn to present. But the order will be as follows. First, we will hear from Kostas Glinos, who's head of unit for open sciences at the Directorate General for Research and Innovation at the European Commission. He will be followed by Dr. Yasuhiro Moriyama, the Research Executive Director at NICT Knowledge Hub at the National Institute for Information and Communications Technology in Japan. Our third panelist will be Dr. Nayavane Medici, Director of Development Policy and Head of the Malawi Office for the African Institute of Development Policy. And finally, we will hear from Mr. Jerry Sheehan, Assistant Director for Scientific Data and Information at the US White House Office of Science and Technology Policy. So without further ado, we'll hear from our first panelist, Dr. Kostas Glinas. Kostas, the floor is yours.
Thank you to the organizers, of the United Nations, to Thanos, Ariel. A lot has been said already, so I will make essentially a summary rather than saying new things. Some of it has been said just in summary by you, Heather, but also by the extensive talk of Shamila Ner-Beduel at the beginning, the Assistant Director General of UNESCO. Next slide, please. So what did we learn about open science from the pandemic? Certainly, there has been more sharing of research results, research outputs. We have seen publishers responding to a call by chief science advisors of a couple of dozen countries, opening up COVID-19 related content. Temporarily, though, we have seen a significant rise in preprints, with scientists sharing their results very, very quickly, as soon as sometimes as the experiments were made. As you said, Heather, we have the publishing of the first genomic sequence of the coronavirus in early January last year has been instrumental, and it was published in an open access repository. It has been instrumental in starting on day one the research for developing a vaccine. So all this is good, but we cannot be complacent and we cannot fool ourselves. Open science is still some way off becoming the new normal. Even with coronavirus or COVID-19 related publications, it is still a minority of related publications that have a data availability statement. In other words, that they make their data openly available. We know that less than 50% of clinical trials publish their data. We have seen that data infrastructures are largely inadequate for dealing with complex problems like developing cures for a disease like COVID-19. We have discovered this painfully in Europe, where we have developed the European COVID-19 data portal, and where a lot of progress has been made. This has been a resounding success on the one hand. On the other hand, we have discovered how difficult it is to bring together heterogeneous data, because this is where the big challenge is having fair data that are reusable, accessible, but also interoperable. And when data are heterogeneous, when you need to combine clinical data, for example, or epidemiological data, on the one hand, with genomic data of the virus or genomic data of the host of the virus, then it is extremely difficult. So data infrastructures have been inadequate, and we have been working on that. We have seen also that publishing models, traditional publishing models, cannot respond to a pandemic like this because they are too slow and they are intransparent. So we believe, new publishing models that can respond to public emergencies like a pandemic. Next slide, please. And of course, what everybody is saying, if we need all that for the COVID-19 pandemic, why don't we need exactly the same things isn't climate change also an emergency? Isn't environmental sustainability or the green transition public emergencies as well, and or any other of the SDGs? So yes, they are, and we need exactly, if we develop this for COVID-19, then we have found a way to do it for all the other parts of science that are targeted to address the Sustainable Development Goals. Next one. So this has reinforced our conviction at the European Commission that open science must be a #1 priority, and we work both on promoting the practices of open science, as well as developing the proper enablers. In promoting the practice of open science, I mean the open access scientific publications, I mean the early sharing of all research outputs. We say that the data, for example, software should be as open as possible, as close as necessary. We want to have professional research data management, and with data I mean all research outputs. We want to have all research outputs fair, findable, accessible, interoperable, reusable. We look very carefully now at the reproducibility of our results, of the research results, and we look very much at the societal engagement responsibility. And this is very broad. It was explained by the Assistant Director General of UNESCO earlier on. We look at the participation of citizens in the design of research programs, as well as at the targeting of research projects themselves, as well as their involvement in the research process, I mean, what we call citizen science. And finally, the vice versa, the explanation, the communication of scientific results from scientists to the citizens. And this is promoting the practices of research. At the same time, we look at developing the enablers, and this is particularly important. The infrastructures. In Europe, we develop European Open Science Cloud, and we cooperate internationally on this to develop the appropriate skills. And maybe one of the most important, and already mentioned by you here, is the rewards and incentives. I said that people do not share data as much as they should, or we have not seen an increase, a significant increase in the sharing of data about the COVID-19 disease. This is precisely because the right rewards and incentive system is not in place. We have new initiatives coming up. These are stated in the bottom of the slide, like an initiative to reform the research assessment system in the European Union, the European Open Science Cloud as an infrastructure for data and other research outputs. And we are also experimenting with a new publication platform, Open Research Europe, that has open peer review and follows an alternative publication, open and transparent publication model. The good thing, an advantage that we have is that we're policymakers, but at the same time, we operate a large research program, so we have the opportunity to implement what we preach in a specific program and learn in the process and feedback onto our policies. And everything that I have been saying is factored in the new Horizon Europe program that has just started in Europe and will last the next 7 years. Next one, please. So just it's a slide about the research assessment, just to make the point again that we want to go from a system today that rewards individual competing scientists. There was a system that rewards collaboration and sharing, which is not the case today. I want to go from a system of publish or perish culture, where the quantity of publication and where you publish is more important than the intrinsic value of the publication. There was a system that knowledge is shared as openly and as early as possible. We want to go from a system that incentivizes researchers to produce particularly publications. There was a system that incentivizes researchers to share, collaborate, and have any high quality. Next one. And of course, here we have the perennial challenge where science is a global enterprise, and scientists, of course, need access to all data, not data just produced in their country. And they need sharing and collaborating with scientists across the globe on the one hand. On the other hand, all the policies and actions for open science or for any other area of policy, of science policy, are most often at national or institutional or local level. And therefore, there is a significant gap there that we need to bridge. That's why this conference is particularly timely and useful. And this is why we in the Commission, we are participating and cooperating at the relevant fora. We are cooperating with the UN. We are particularly glad, satisfied with the draft UNESCO recommendation that was explained this morning, the Open Science Working Group of UNESCO, that I see some of my colleagues there participating in this G7 Open Science Working Group also present in this. We're cooperating with OECD, but also we have several other international organizations with which we collaborate, and we have lots of bilateral cooperation with particular countries on open science. Thank you for your attention.
Thank you very much for Kostas and Heather, who are so really international experts of the open science. They made a very comprehensive review on the basic concepts of open science. And my talk is just so this is open science landscape in Japan from my viewpoint, which is mainly on the data aspect of the open science. And I'm having a couple of heads of Science Council of Japan and also G7 Open Science Working Group and the Japan Geoscience Union. And I'm working for atmospheric science and space physics too, and NICT, which is Information and Communication Technology, formerly, which is a radio research laboratories in Japan. Okay. And I'm not talking about the G7 in detail, but G7, G8 activities are really important works for when Japan started to discuss open science in the government and the more wider communities. And the starting point was that 2013, under the UK presidency, the G8 agreed the Open Data Charter, and also the science ministers agreed statement, including the open research data. After that, the Japanese government started to investigate and study the open science. And I joined their group, and we made an expert panel in Japan. And after that, in 2016, under the Japan's presidency, G7 science ministers agreed to set up the new G7 Open Science Working Group, co-chaired by European Commission and Japan. So I have been working very closely with Kostas and his colleagues. Yeah. So and the diagram in the bottom, you can see that after the setup of the Open Science Working Group, we had activities every year so far. Okay. And I'm coming to the Japanese situation. Under the Japan's national strategy and also national science and technology basic plans, which lasts for 5 years, and we renew it every 5 years. And the Cabinet Office of Japan played a central role to promote open science in the government, and they started the expert panel of open science. And I joined it, and we have successfully published the first national report of open science principle 2015, and followed by the data policy guidelines and also trusted data repository guideline. Fortunately, it was in harmonization with core trust sale. Yeah. And also government started the new research program, R&D program, Moonshot. Let me show the pointer. Yes, Moonshot Research R&D program. In it, they are trying to have a system of the new research data management aligned with the open science principle. This is a very new trial, and they are trying to extend this practice to the other programs too. And in the Academia Science Council of Japan, the council president requested the setting up the open science committees just under their board since 2015, and we had 3 committees so far, and also the disciplinary data committees have been working very actively in informatics and bioinformatics, science, space physics, etc. We are trying to make more activities there. And this is another example of open science practice in Japan. For instance, data management plan is being adapted to several programs in public funders. since 2017, and also data publishing platform in association with the electronic journal platform, which is funded publicly through the Japan Science Technology Agency, JST. Yeah. And the third line, the data management infrastructure. This is a really important, platform, how the researchers can work together and how the research ecosystem can be built under the principle of open science. And the NII, this is the National Institute of Informatics, they're trying to, is developing research data cloud to be a national academic platform consisting of the research data management platform, publication and discovery platforms, and they are working with the Center for Open Science and also EOSC, European Open Science Cloud, as the international collaboration is really important here too. And also, some universities are trying experimental data repository inside their university libraries or their departments for their university scientists, because international journal policies are changing and they are facing the difficulties for data sharing to make international publications. Okay. And always those are really important to involve the community, research community. This is the to-do, and some part is doing underway, but it is a really challenge for us. And about the COVID-19, I haven't touched about the pandemic issue. That pandemic made a really serious impact to Japanese society too, of course, and it changes the people's way of thinking and the people's way of behavior and thinking about the future. And but in academic areas, genome data has been shared through the academic body called the DNA Data Bank Japan, which is part of the international coordination body, so-called INSDC. They provide genome data open sharing for all over the world. Yeah. So lessons learned included we and wider communities understood the importance of the timely sharing of scientific knowledge and data in Japan, especially in my sense. And also at least part of the scientific communities, including the very senior scholars, understood the importance of the cultural changes in the science technology sector. This is really important, and the social science councils and the other communities are trying on the way to having inertia for the change. And of course, other sectors of the citizens, economies, and governmental players are needed. Also, industrial issues are important, but they are intellectual property issue or personal information issue that we have barriers in it, but we are on the way of the development of the ICT infrastructure and the social technology. And the Society 5.0, let me introduce this word as a concept proposed by Japanese government 5 years ago. It is a human-centric society with a sophisticated fusion of cyber and physical spaces to enable the economic growth and at the same time to solve the societal challenges, including SDGs and so on. And this year, 2021, the new 5-year National Science and Technology Innovation Basic Plan started with deeper insight of the digital transformation in the COVID-19 situation and beyond. And this concept ultimately targets the contribution to the welfare of all the human beings and also the society with more trust. This gives global value of our concepts, and we hope there are more contribution to the international community and work together. Yes, this is my presentation. Thank you very much.
Open science, and I'm thinking from my perspective here in Africa, I've seen both ends of the spectrum where data are freely given, even some highly confidential data. I was once given a database with people's HIV status and their names and addresses and all that as one end of very bad practice of data sharing. And then yeah. And then on the other hand, when people realize that data are actually very good currency, then you do have a problem where people now want to hold data because they realize that they can get partnerships, they can get engagements, and also then make some income to top up on their salaries. As I started by saying, we've seen both ends. I've seen open sharing of data where essentially some of the data shared shouldn't have been shared, to the other extreme where scientists hold data because they realize that they can get connections and collaborations with other scientists and earn money that way. But what I wanted to do today is to really just share, from the COVID-19 lessons and implications for climate change. Some of the lessons include the fact that we've realized that the most precious currency is actually staying healthy longer. And the second lesson is that partnerships are important for quicker, robust solutions. And thirdly is that global challenges require global solutions. So COVID-19, climate change, indeed the SDGs, they do require replicable research, ethical partnerships, and open access. And then 4 is an important principle as well, which is that we really must work at communicating our science. Otherwise, we do allow a lot of misinformation and myths, and indeed sharing of information that can be harmful. Next slide, please. Right, on health and why it's important, health and life, they matter most. And COVID has taught us that staying healthy and actually staying alive is more important than wealth. And by that, I mean individual wealth, household wealth, national wealth, and indeed global wealth. So we've seen that countries are willing to spend a lot of money to maintain health. We've also seen individuals and households willing to spend money, but also more importantly, willing to change behavior to stay healthy. People are willing to wear things like masks, sanitize, things that perhaps are a nuisance at times, but indeed are important nevertheless for staying healthy. We've also identified the fact that our destinies are intertwined. We cannot, assume that something that's affecting China, Africa, the US will not affect other parts of the world. So I have been interested with the COVAX global commitment to ensure that the majority of people are vaccinated. But as we heard earlier at the start, the fact that some nations are actually holding some of the vaccines, not sharing in ways that actually are meaningful for essentially global security and global health. The important thing being that majority of Africans at the moment are not vaccinated, and unless we become bubbles and close borders, don't interact with anybody, we will be in situations where we will perpetually be getting waves and new variants of the Delta, of the COVID vaccine. So essentially, we should care because our health depends on each other's. And then I think that, with the climate change, there is global commitment, but importantly, we do need to see this global commitment actually elevated to the same level that we've seen the elevation of commitment to COVID-19. We have only one Earth, and I should care because we only have one Earth, and what I do will have repercussions for everybody else on the planet. The World Health Organization estimates that there will be an additional 250,000 additional deaths due to climate change effects between 2030 and 2050. And most of these deaths will be happening in low and middle income countries. And when we think about that, we do see that essentially the burden of deaths, etc., is concentrated in the poorer countries, who in many cases are perhaps not the most heaviest of all polluters. But rich countries will not also escape. They estimates that by 2100, life expectancy in Europe will begin to reduce as a result of climate change, so between 0.24 years to 1 year. So in the same way we've seen COVAX and we've seen commitments to vaccine development for COVID, we do need global funds to help the low and middle income countries on behavior change, on communication, and action, for example, action to reverse loss of forest and biodiversity, to reduce water and soil pollution. Next slide, please. Okay, the other lesson we've learned is the importance of partnerships, and some of the lessons from COVID have been mentioned already. The right-hand side of the slide just shows the interrelationships and the linkages that we've seen develop. We've seen researcher-to-researcher engagement, crossing borders, Chinese researchers, US researchers working together. We've also seen the interaction between researchers and policymakers. I've got a picture there on the left in Malawi, where we've seen scientists and policymakers sharing the podium as they communicate information about COVID. And equally also, we've seen research being translated quickly to inform how COVID patients are treated. So health practitioners learning quite quickly in sort of like real time as the research is produced. And we have seen also the link between researchers and the media, where we've seen some of the open science publications being translated and myths being busted. But here I emphasize that we do need more work, because what we have seen a lot of is more of the science from the high income countries being accessible, available, and being used to come up with some of the maybe frequently asked questions, or indeed some of the messaging. And yet there are a lot of questions that are happening in some of the poorer countries, but because of that tenuous link between the researchers and the science editors and the media, we do end up in situations where not a lot of the research in poor countries is being heard. I wanted to just also highlight the issue of the mass information, education and communication, the fact that this is still very, very weak, and as a result, we do have quite a lot of social media news that actually are seemingly real and true, but actually are untrue. I've lost count of the number of times I've gone on social media to write things that I have read from scientific journals about the COVID virus, and trying to dismiss or to bust myths that are actually happening from religious leaders, talking about the COVID vaccine as a thing that will make people sterile, or indeed a thing that will make people to fall ill and to actually succumb to illness. So we do need to do a lot more with information giving as well as communicating to the public. Next slide, please. So the last one point I want to say is that the global challenges do require global solutions. So COVID-19 and climate change are global, I should say, mega challenges, and they do require the global solutions, and they do require scientists, policymakers, media, the public working together to identify solutions. I would like to make a plea that the research for addressing such global challenges does need to be translatable and generalizable. Oftentimes I go and talk to a policymaker and I am sharing research that's happened, say, in Pakistan or in Latin America. And the question always is there no research that you have from this country, or at a minimum from the region, from other neighboring African countries? Because that is so important in decisions on whether to take that research and put that into policy or not. And then I also want to make a plea for the fact that legitimate research should actually involve and engage researchers from low and middle income countries, particularly if we are going to come up with policies at a global level that then do affect researchers and do affect the communities in these places. And then open access is important, especially if we collect data from low and middle income countries. I just think it's unethical to actually then not actually make that research accessible to the very people who were the subjects of the research. And then the final point here is that article processing charges, they should be within the reach of researchers from low and middle income countries. So the open access discussion, there is making accessible good quality science and making it accessible for everybody to learn from. But there is also allowing the research from low and middle income countries to become open access. And often that is a challenge because some of the top journals, you have to pay a lot of money to be able to open your research. I have worked both in a low middle income country, and I worked in a UK university where essentially for any research that you were able to publish, the university would make sure that they paid money for it to be open access. You don't get the same in a majority of the universities in low and middle income countries. So their choice is really journals that are perhaps not as high ranking as say the Lancet or Science, etc., just by the fact that they cannot afford the article processing charges. Final slide, I think. Okay. So my few points are that for open science, we really must invest in one is the knowledge translation, which is essentially being able to speak the scientific findings in ways that essentially other people can understand. So there's the translation element. And then the other one is that the science must be packaged for a range of audiences, science for researchers, science for policymakers who are unlikely to be reading scientific papers, and indeed science for the public who perhaps might engage more with mass media, social media, etc. As I've said before, social media is awash with misinformation, and we do need to rebut that with solid information, and that means engaging our science in the social media as well. And just like with COVID, there have been a lot of scientific issues that people have failed to understand, the rate of reproduction, what does it actually mean for the general public? So too, I do find some of the climate change messages when people talk about variability fluctuations, how to then explain to someone like my mother who keeps saying, but it's so cold, why did you say that the world is getting hotter? And what does plus 1.5 degrees mean, carbon neutrality? These do need to be translated and packaged in ways that are actually accessible for a range of audiences. I think the last slide is just a thank you slide, but the final slide essentially just says that this is a shared destiny. We are in it together. Climate change and COVID-19 are mega challenges, and their solutions will require us to bring our ideas together as well as pool our resources. I thank you for your attention.
I love the emphasis on the need for us to be focusing on better communication of science. It's a theme we're hearing throughout the initial interventions. Our final panelist, but certainly not our least panelist, is Mr. Jerry Sheehan from the US White House Office of Science and Technology Policy. And I do believe that Jerry is just on the phone, so we are not going to see slides or him at this point. Am I correct?
That is correct, Heather. Can you hear me?
We can hear you fine, Jerry.
Okay, great. Well, thanks. Yeah, thanks for that introduction, and apologies. Yes, I am not using slides. I don't have access to the video, so I'm hoping the audio works well, and that my remarks will be engaging enough to keep your attention. By thanking the organizers for taking the bold step of putting on this conference today, despite the continuing circumstances we operate in. Because I think that the issue is one, as we're discussing today, is one that is of great urgency and great utility, even as we try to get through the situation we're in now with the pandemic. So let me just start by saying again, I think in the United States, we feel we've made great progress over the last decade or so in implementing open science. We continue to operate within the U.S. federal government anyway, under the direction of the OSTP, Office of Science and Technology Policy Memorandum on increasing access to the results of federally funded research, which was issued back in 2013, about 8.5 years ago. And it directed all of our federal science agencies that spend more than $100 million a year in R&D, research and development, to have plans for making publications and the digital data resulting from that research freely and readily available to the public with minimal delays, while respecting security, privacy, other legal and ethical limitations. And I'm pleased to say that in that 8.5-year period, more than 20 federal agencies that are subject to the memo have developed and implemented policies that fulfill these objectives. So they now have procedures in place for making their research publications accessible with a delay of not more than 12 months after the date of publication, in agency designated repositories, and procedures for ensuring that researchers develop and submit data management plans describing how they'll make the data resulting from their research more accessible to others. And we've continued to work together across the federal agencies over the last 8.5 years to improve the coordination and the implementation of these policies, tackling challenges around, for example, risk management associated with data access, automating access to information about publications in our repositories, identifying even common elements of a data management plan and desired characteristics of data repositories for our federal research. And we think these make our public access and our open science policies stronger and simpler to comply with. All of this work, I think, positioned us very well to leverage open science during the COVID-19 pandemic. And as you've heard before, through OSTP and with the leadership of science leadership of many, many other nations, we were able to put in place a couple of calls to action early on in the pandemic that had a real impact. The first, is, as you've heard about, was a call to scholarly publishers that to make the publications related to COVID-19, and in fact to a variety of coronaviruses, freely and immediately available to the public in machine-readable forms, and to do so through major platforms such as the PubMed Central platform mentioned earlier today, operated at the National Institutes of Health. And it was refreshing to see more than 50 publishers and journals responding to that call and volunteering to make their coronavirus articles accessible under those conditions. Recognizing that the research community, the biomedical research community and first responders were making use of that information, we also took steps then to sort of expand upon this concept of machine readability to engage the artificial intelligence and machine learning communities in the research process through a second call to action that OSTP issued also in March of 2020. OSTP also then convened a team of researchers from government, university, academia, private foundations to develop and release what's known as the COVID-19 Open Research Dataset of scholarly literature about coronaviruses. It launched with something like 29,000 articles back in March of 2020. And as of today, I think it has more than 250,000 articles that are freely and readily available in human and machine-readable forms. And this has served as the basis for several computational-based challenges and competitions to develop new natural language processing techniques and actually to apply them to gaining new knowledge about COVID-19 and about other coronaviruses. And this is just one of several examples of, I think, successful use of open science in the COVID-19 response. We saw, in addition, at our National Institutes of Health, launched a preprint pilot to make sure that any preprints resulting from NIH-funded research were readily available through their PubMed and PubMed Central systems, which are widely used in the biomedical research community. We saw efforts to use the clinicaltrials.gov registry and results database to streamline the intake of information about COVID-19 related clinical trials. And in fact, through good collaboration with the World Health Organization, to bring in information registered with them and their International Clinical Trial Registry platform to ensure that there was a source for comprehensive information on all the clinical studies being conducted related to COVID-19. I think there are now more than 10,000 of those listed there. And as Costas said at the beginning, still work to do to make sure that the results of those trials are publicly available at that kind of resource. And we saw similar steps, trying to coordinate around genomic data collection and processing and dissemination to ensure that we had consistent information collected and made available through publicly accessible repositories to aid us in tracking the emergence and the spread of COVID and the emergence and the spread of various variants of COVID-19. So we've done a lot, and we're actually now at a very good time, I think, to do exactly what we're aiming to do in this conference, which is to take stock of the lessons learned and to help us learn how to adjust and apply open science policies to help position us for the future and future global crises. We in the U.S., in fact, are responding to doing this as part of a response to a letter that President Biden sent to the director of OSTP, Dr. Eric Lander, before he even assumed his duties as OSTP director. He asked him 5 questions, the first of which is, what can we learn from the pandemic about what is possible or what ought to be possible to address the widest range of needs related to our public health? He asked about how breakthroughs in science and technology can create new solutions to address climate change and improve health, grow jobs, especially in communities that have been left behind. We asked how we can remain a leader in science and technology of the future, and in particular, how we can guarantee that the fruits of science and technology are fully shared across the country and across all of our population, and how we can ensure that the long-term health of science and technology in the nation. And I would argue that open science can play a role in helping answer all 5 of these questions. We saw during the pandemic that considerable progress, rapid progress in information and data sharing was made possible by building on some of our long-standing, well-recognized, heavily used, trusted information and data platforms. We often had to make adjustments to them to help work faster, collect data in new ways, and disseminate it to a broader set of users. At the same time as we were developing new data repositories and new information dissemination platforms. And I think the lesson is we need to be anticipatory. It's hard enough in a pandemic to make use of information we can access, and if we can have robust information systems and services and platforms in place that we can use for the next challenge, we'll have a head start on disseminating information in ways that our users know how to access. We also saw, I think, as Costas was saying in the beginning, that there are considerable challenges to making research data and other data fair, findable, accessible, interoperable, and reusable. In the United States and elsewhere, accessing and combining data, in particular from clinical and public health systems, was difficult and complex, sometimes due to policy limitations like privacy issues, but also because of technical obstacles, a lack of standardization that could promote interoperability, or lack of metadata to help improve reusability of data. In the US, in fact, the president issued an executive order on a data-driven response to COVID-19 that calls upon our federal agencies here to help facilitate the gathering, the sharing, the publication of COVID-19 data, coordinating across the agencies, as well as with state, local, tribal, and territorial authorities, We're looking at improving on our approaches to making data open in machine and human readable formats, and to review the effectiveness and interoperability of our public health data systems. I think importantly, we also saw that open science and our information and data, in addition to being open, need to be equitable, secure, and trustworthy. We saw great iniquities in the way that the COVID-19 pandemic affected the population, certainly here in the US as well as abroad. And existing iniquities were in fact exacerbated by the pandemic, which hit disadvantaged populations particularly hard. We need to ensure that open science doesn't exacerbate these and in fact becomes a remedy to some of these disadvantages, ensuring that information and data are reflective of the experiences and the work of diverse communities and is available and accessible and usable by them. We saw that data security and data integrity were paramount. The proximity of the data and the rapidity with which it was affecting policy decisions just heightened the need to be sure that the data were accurate. Data integrity was maintained throughout the life cycle and remained well preserved and archived, so it could be researched and accessed again. And as some of my co-panelists have said here this morning, or this afternoon, depending on where you're coming in from, we saw serious concerns about misinformation and disinformation in the community that have highlighted the need, especially for those of us in the research community, to provide trusted information and data and to find new ways to signal the trust of information. We're working in the United States on improving scientific integrity, which is aiming to restore trust in federal science and in government overall. And that kind of trust is something that we need in any kind of a crisis response. So I think these three additional concepts, equity, security, and trust, need to become embedded in the future of open science. We need science that is open, equitable, secure, and trusted. And as has been brought up by my colleagues on the panel, we also need global cooperation. Whether it's about sequence data to help track the emergence of new COVID variants, or it's weather and atmospheric data to help us engage and measure changes in climate and others, we need data from across and around the world in interoperable, accessible forms so that we can have a more global perspective and understand how changes in one part of the world are going to affect others. I think this panel itself, with its global representation, is a demonstration of the global interest and the global activity taking place in making science more open, equitable, secure, and trustworthy. And I look forward to the discussion today to identify ways that we can achieve this future and adopt this broader concept of open science and apply it to a whole host of societal challenges. Thank you very much.
Thank you so much, Jerry, and thank you to all of our panelists for your very thought-provoking interventions. And also thank you to the participants who have put lots of questions to the panelists while folks have been talking. One of the primary themes in the questions is around this notion of the importance of clear scientific communication to improve and build the public's trust in science and also to combat misinformation. One of the questions that we had is for actually each of the panelists, whether you have ideas for where momentum for sort of jump-starting, prioritizing this kind of communication, where it might come from. Is it something that will be generated from sort of the local university and research institution perspective, or is it something that national policy organizations and policymakers can help put some muscle behind? Kostas, maybe we can start with you, and then if any of the other panelists would like to jump in, happy to hear.
I believe both. So it is, I think, policymakers have a very important role to play, funders have an important role to play, and institutions or the employers, if you want, of researchers have a particularly important role to play. So it all comes back to this issue of incentives, rewards, or the way researchers are being assessed, and communication is not taking center stage usually. So some people are gifted for that, and the ones that are gifted need to be promoted. This needs to be recognized in the assessment system. I think there are institutions or universities for example, that already do that. It's a small minority, probably, but this needs to be done more systematically. So this is part of the reform of the research assessment system that we desperately need, that I described earlier, that needs to reward not just publishing in high impact factor journals, but it needs to recognize and reward a broad variety of behaviors that are good for society.
Thank you. Would any of our other panelists like to comment on this? Dr. Medici?
Okay, just to say, my organization, the African Institute for Development Policy, we started off with knowledge translation, because we realized that there was a lot of research at development in Africa, but actually the policymakers were not able to use that research. So we started off with a knowledge translation. We've come on to also do our own policy research in recognition to a gap there. But some of our lessons are that we do need to actually work with researchers to help them in this science of knowledge translation. We do need to work with the policymakers to also understand how they can use research and where they need to look for the research. We do need to work with the media so that essentially they can also report science, correctly. Not everyone will have the gift of knowledge translation, and that's why there is need for people like us who can do that work if researchers are not able to do that work. But that's my way of thinking. And unless we do that, we will have a lot of research that's out there. It's being used by the researchers and the scientists, but not used so much by the policymakers, and indeed not helping to bust the myths that are so prevalent in the social media, because a majority of the people do not understand that. Thank you.
And I really appreciated your point about the need for us to be clear in terms of translating sort of the specialty terms. It's clearly an important lesson learned from COVID that's directly applicable to the climate change milieu as well. We have Kostas, you started to talk a little bit about the importance of incentivizing researchers and individuals for open research communication practices, but open science practices in general. One of the questions that we had from the audience is really broad, but I'm interested in hearing your perspectives on maybe one or two specifics. They ask what incentives are actually needed to expand open science, specifically when we're relying on metrics like the impact factor right now, which actually impede open science. Do each of you have a suggestion for a behavior, a practice that could and should be incentivized in order to promote open science practices throughout the research life cycle? And maybe we can start, Jerry, with you, and then go to our other panelists.
Yeah, I don't know if I have a solution in place, but I think actually your question sort of captured it. We know that the metrics that we've developed to date kind of work in the system that we have. And I think it's a kind of a question of applying, new metrics. What do we want to measure in terms of the impact of science, which may be more important than the impact factor of a journal, right? So if we can begin to look at whether it's other measures of citation or use or significance or importance, I'd love to hear good ideas about how we do that, because I think that gives us a new, a new kind of set of measuring tools that can be applied across the research cycle, whether it's at universities for promotion and tenure, whether it's in funding agencies and looking at grant applications, whether it's in other institutions, looking at an institutional level across the quality of science that's produced. So I think we need a lot of new creative ideas for how to develop those and make sure that we are as much thinking about freeing up from our current set of systems and incentives, and finding ones that are appropriate for the new vision that we have for science.
Thank you. Would any of our other panelists like to comment on that particular question?
Yes, yeah. As the Jerry said, it is really so important about the difficult issue right now, and yeah, metrics for citing data and usage of data are one of the potential solution in the future. And but also you may notice that in the science community, scientists thinks that his own recognition as a expert scientist important. That means that we need to have a different perspective in a science community to look at that. So this person sharing this important data with the community, and we evaluate his performance and his achievement in the data management and the data sharing. That's so this is a part of the cultural change, and it will work very well together with new metrics if it works in an international standard. Yeah, this is my perspective. Thank you very much.
And there's questions, Jerry, just about the fact that the current U.S. policy memorandum for open science is essentially 8 years old, and wondering whether there are specific plans afoot to create additional funded policies beyond the earlier memos.
Well, I guess I would say if there were concrete plans I could discuss with you, I would have discussed them with you. But I will say, I mean, we are now, as we're staffing up the new OSTP and identifying priorities, right? We are trying to look at open science as an issue and identify essentially for 2021 and beyond, what do we need to do about open science and how can we advance it, taking into account the experience that we've had over the 8.5 years, and in particular, some of the experience that we've had just over the last 1.5 years in the pandemic, which, as we've all been saying, has sort of opened new opportunities. It encouraged us to experiment with new systems, and we saw some of the challenges around those. So I think we're in the process of really listening to a lot of people and a lot of input now to try to decide what our next steps are going to be. And I'm very eager. Part of my participation today is as much to share with all of you what our observations are so far, as much as to hear where the community is going, what are the issues that we need to address, where are the roadblocks and obstacles that still exist that we should be trying to tackle.
One final question from the audience to give each of our panelists the opportunity to do a very quick final comment. And the question was, what is the most important step that you would recommend that we take as a society to make sure that climate science research is openly available to all? If there was one thing you had to focus on, what would that be? And maybe Dr. Medise, we can start with you.
It would be making the cost of publishing the research cheap for researchers in low and middle income countries. $2,000, $3,000 is way a lot of money, more than their monthly pay. So we really do need to reduce that.
Thank you.
As far as I know, in the climate science, the scientists tends to accept more easier about the data sharing. For instance, the IPCC, Intergovernmental Panel for Climate Change, has set up a task force for data. So they are preparing, for instance, a complete data set to be shared with the policymakers about the summary for policymakers documentation, for instance. And it is the first step, and it's not easy to share the whole data, but it is step by step. Yes, this is my comment. Thank you very much.
Thank you so much.
So I'm going to come back and say again, I think to be anticipatory, right? So there are challenges with data sharing and we need to and information sharing. We need to think about them now so that when we come to whatever the next crisis is going to be in this space, we're able to quickly respond, and to recognize, as has come up here, that it's as much about sharing the information and data with other scientists as it's going to be with people who are involved in policy making and decision making at global, national, and local levels. And I think keeping that broad sense of users in mind will help us think about more effective ways to open that kind of science for all who are going to need to make use of it.
I think that's a great note to end on. And I'd like to thank all four of our panelists for your very informative and engaging interventions, and particularly for raising the themes of the consistent need for global collaboration and clarity of communication in the scientific research enterprise as sort of centerpieces for helping us to keep the urgency of translating the effectiveness of open science practices that we saw in the COVID environments into other pressing scientific and societal exigencies, and in particular climate change. So thank you so much to all of our panelists, and thank you to our host at the UN for hosting this panel.